All right, so thank you everyone for hanging with us through this pregnancy and migraine webinar. We're going to jump over to a couple questions that we have. Thank you if you've been chatting amongst each other. If you have any questions, you can go ahead and put them in the little Q&A box and we will get to them. And also, as a reminder, we will make this webinar, the videos available soon, so you can find them either on YouTube or on our website. All right, so the first question, which you had already kind of discussed, but we're just going to go over it again in case it was missed. For Dr. Donnelly, thoughts on Maxalt or rizatriptan during pregnancy and postpartum?
Great question. So I talked about, so Ashley Holdridge did the pregnancy talk last week, and I feel happy to discuss any of that as well. And full disclosure, she and I just published an article together on devices in pregnancy and lactation, which I did a terrible job bringing up anything about devices, even though I just published on it. But devices are also really a great idea in pregnancy, so I'll give a little plug to that. So using whether it be occipital nerve blocks, SPGs, Nerivio device, Cephali device, GammaCore, all of these are particularly viewed by experts as being safe in pregnancy and lactation. So those ones, I don't even think there's much of a debate in terms of safety, in terms of devices. But regarding our acute medications that are in the triptan family, in lactation, we highlighted that elatriptan is one of the safer ones, and Zomig is probably the only one that I would avoid in the lactation period. Now, in pregnancy, it's category C in pregnancy. The FDA did away with their pregnancy categories in 2016. So I refer to the pregnancy categories sort of as how we think about Prince, like the artist formerly known as Prince, it's the formerly known as category C, but then the FDA never replaced it with anything else. And so you'll still hear us talk in terms of category A's, B's, C's, et cetera. So all of the triptans are category C in pregnancy. There was a large cohort study that was done by GlaxoSmithKline looking at sumatriptan in pregnancy, and there were over 300 women who had sumatriptan while pregnant, and the rates of miscarriage, teratogenicity, and intrauterine growth restriction were looked at, and there was no increase in the number of those issues. Why did they look at those in particular? Well, teratogenicity, obviously, to have any sort of malformations or any sort of problems related to a medication is profoundly important to look at. And then they looked at intrauterine growth restriction, specifically because there is the vasoconstriction that happens. And so when you think about placental artery vasoconstriction, would that then cause there to be a smaller baby as a result? And then obviously miscarriage, fetal demise is profoundly important to look at. So they looked at all of those and there was no increased risk. So I feel pretty comfortable using triptans in pregnancy. One of my program directors at my institution of training, she does not feel comfortable using them in pregnancy. And I very much respect and value her. So you're going to run into differing opinions, even within two different headache specialists in terms of looking at that information. And then my obstetric neurology training that I did at UPMC, she feels comfortable with triptans in pregnancy. So it's a different preceptor for me at each of the places that I did extra education, have differing views from each other on the topic. But my take home is that I feel pretty comfortable with triptans in pregnancy and in lactation.
Great. Thank you for that. Also very exciting that you published research on devices during pregnancy. So offline, if you want to email us that link, then we'll make sure to share that research because that's very exciting. Okay, the next question. Definitely. Okay, great. Thank you. Sorry to cut you off. The next question, I'm going to put this up to the both of you, and then I think I will chime in as well as a new mom. The first few months are hard with sleep deprivation. And this person wants to know how you dealt with fatigue. Marina, let's start with you, and then we'll go over to Dr. Donnelly. But you're on mute real quick. There you go. Nope, still on mute.
I'm laughing to myself. Yeah. I said I'm still struggling with fatigue, but well, I think as new moms, we don't like asking for help because we feel like we can handle it ourselves. But I think it's important to ask for help. I think people want to help you and they don't know how to. So it's important to reach out to people and ask, can you get me this at the store? Can you come over and watch the baby while I shower? Can you come over and do this? And it's also important to not just ask for help, but also accept help when somebody does offer help. Say yes to your partner when they offer to do laundry, even if they do it wrong, or say yes to, a mother-in-law if she wants to watch the baby, or to, let go of that control. And I know that for me personally, I had a lot of emotions the first few months after having a baby. I'm assuming it's common, the postpartum's feelings, there were lots of feelings. And so I felt like I wanted to hold on to control of everything. But in retrospect, I wish I had let go of the control and let people help me and rested more. And I think if we let go of a little bit more control, we could rest more and get rid of that fatigue. If you're breastfeeding or if you're bottle feeding, if you're bottle feeding, allow your husband to feed the baby at night. If you're breastfeeding, maybe you could, if it's an option, pump once in a while and let the husband or partner feed the baby at night so that you can, so that your sleep is not interrupted and you could, sleep through a few feedings. I know it was really hard to be constantly waking up to feed the baby. And I know that this is controversial, but for me personally, sleep training helped. At about 3 months, we put the baby in their own bed and we did not let them cry forever, but we came and checked on him, and there was crying involved, but we found a way of doing sleep training that we were okay with and that the baby was okay with. But the point is the baby started sleeping through the night and then I started sleeping through the night. And that obviously helped with the fatigue. So look into some kind of sleep training as well. And that maybe Dr. Donnelly can comment on the B vitamins. Vitamin B2 is good for migraine, but I believe that the B complex can be good for energy. So maybe you can ask your doctor if there's any supplements you can take as well to help your energy levels. I mean, it's a very difficult time, and maybe your doctor has some ideas to help you during this period to help you with some energy. Eat well. Don't forget to eat because you're taking care of another human being. But don't forget to take care of yourself. Talking to you, Molly.
Oh, I'm trying. Dr. Donnelly, do you want to jump in and talk about how maybe some medical perspective, but also being a mom who also has migraine?
Yes. So Marina, you gave a lot of very similar advice to what I would give. I definitely struggled in the postpartum period with both of my pregnancies with postpartum anxiety and depression. And so I did not do well with relinquishing control to really anybody else. And I had a lot of mom guilt over working as much as I did because I was working 80 hours per week when I had both of my kids. And so if I was home, I wanted to be directly feeding them. If somebody had just bottle fed and it was 30 minutes before I came home, I would go into a rage because I was supposed to be directly feeding when I came home. So I struggled. And looking back, I agree. If I could have relinquished some control, it would have been better than holding on. Oh, hey, buddy, mommy's still in a video. Sorry, the little one who just entered.
All good.
So as I have the stiff arm up. everybody, mommy's in a video. Sorry. Okay, we're gonna have a friend for a second. Okay.
Yay, guest star.
Okay. Let me try.
If you need to take a minute, if you want to just mute for a second, yeah.
Hey, Colin, can you help your brother out of the room? Okay. All right. 1 second. Let me pause.
Yeah, go ahead if you want to pause.
You guys. I apologize.
No worries. I will jump in. I talked a little bit about this last week in our other webinar session, that I think saying yes is the most powerful thing you can do. Accept people's help and say yes when people offer. It's very, very difficult. I think the three of us can talk all day about this, but it is very difficult to give up some of that control. It's really hard, but saying yes to people who are offering to help can really make a big difference. And before we jump back over to you, Dr. Donnelly, I also wanted to share that my husband and I, the way we got through it was really difficult. And I could talk about sleep and my baby forever because that was our whole life for 5 months, but we tried to work together and we took shifts. So he would take first shift and I would take second shift so that each of us could get at least a consistent 4 hours of sleep. Sometimes we would get a little bit more and sometimes we would get a little bit less. And then after a certain amount of time, I don't know, maybe 3 months or so, we started taking shifts on you get a night and I get a night. So we each would get one good night's sleep. And then the other night, the person would be with the baby. So that's kind of how we did it. It was the biggest struggle. It's the worst. Our sleep is still a mess, but our baby sleep is much better. So just power through would be my advice, and also say yes. And I'm going to turn it back over to you, Dr. Donnelly, for whatever other advice you have for fighting the fatigue and the exhaustion.
Thank you for understanding. At least I'm in an audience with 100% moms.
100%.
I thought it was going to be me. My kids would be photobombing.
So we have a little pool in our neighborhood, and so I asked my husband to take them to the neighborhood pool. And as soon as I heard the footsteps up, I was like, oh no, they're coming. I knew they would come in here. We have the better tub in our bedroom, and so I was like, they're gonna come in cold and needing the tub. But my husband has reined them back in, and they're out of this room, which is good. So I also did something that was kind of controversial in the postpartum period, and I in no way give medical advice to do this. This is 100% personal what I did, which was I co-slept and I breastfed in co-sleeping. The American Academy of Pediatrics does not recommend doing that. I, as a medical provider, would never, ever, ever tell my patients to do that because I really adhere to the the strict medical advice that I'm supposed to be giving. For us, it was our level of survival because I was able to dream feed all night long. And again, there's a lot of mom guilt with wanting to exclusively feed my babies because I wasn't there much. And so when I was home, I wanted to be nursing and connected with them 100%. So that was my, we all use controversial ways of getting through this period of time. And I think it's important to still listen to your pediatrician and listen to your OB in terms of advice. And so I like to, again, reiterate, that's not the advice I would give others, but it was how we survived.
Well, I appreciate that honesty too. And I think that our viewers do as well, because it is such a challenging time. And a lot of people just need to do what they can do to take care of their baby, to take care of themselves. So I really appreciate your honesty in that answer as well. And also for the disclaimer that what we say here is not medical advice, and work with your care provider. Okay, our next question is for Dr. Donnelly. Is there any connection between migraine and postpartum depression?
There hasn't been a direct connection made, but I would say yes, in the sense that there is a 70% comorbidity of anxiety and depression in patients who have migraine. So that means that in somebody who has migraine disease, there is a 60 to 70% chance that they also have anxiety or depression. Having any sort of chronic illness or chronic pain syndrome increases our risk of having depression. And I would only venture to say that if somebody has your rate is already high of going through having postpartum anxiety or depression just by virtue of being postpartum. At least 30% of patients do experience postpartum depression, and that's one to admit to it. To so many other people who are suffering in silence and just don't want to admit that they have it, or don't have the insight that they have it, or are just trying to survive and kind of power through. So there haven't been any studies that I'm aware of that directly point out a connection, but I would say, gosh, there has to be a connection between the two.
Thank you for that. I want to chime in just briefly because someone who I think, like many of you out there watching, probably also deal with this, but I have been diagnosed with anxiety and depression for my whole life. That's just what it is. So I was really concerned about postpartum depression. I have good news for anyone who's just curious. My anxiety was excellent during pregnancy. I didn't have any. I was the most chill I've ever been. It was awesome. And then postpartum, I did fine. Anxiety kicked back in a little bit, but I was really prepared for a severe postpartum depression. So I worked with care providers just to have a plan. And I did fine. So I did really, really well. So I think that's important to know that if you do have anxiety and depression and migraine, yes, they are all linked. To what extent while you're pregnant and postpartum with migraine? Again, like Dr. Donnelly said, we need more research out there. Okay, so our last question so far, and I'll take one last call for questions from our audience, but our last question I will direct to you, Dr. Donnelly. Can pregnant women or postpartum women participate in research?
Ooh, good question. Yes, there are finally some pregnancy registries and lactation registries for medications. Harvard is running most of them. I will find the links to the Harvard studies that list. They have one for depression medication. They have one for migraine medications. So they do have them for various different medications because it's just such a sorely needed piece of research and education for us. We recognize that almost nothing ever gets approved for those populations, but to at least have the data so that we can inform and empower our providers and our patients is key.
Wonderful. Well, thank you all so much for joining us tonight. That wraps up our question and answer period.